And our conversation with our friends from the Indiana County Veterans Providers Group, brought to you by Marcus & Mack, a law firm representing injured people. Diann Overman, good morning.
Good morning.
Good to have you back with us.
Thank you.
And you brought an interesting fellow with you today.
I did. I said he's far more interesting than I am. This is Mr. Shaun Shenk. He's with the Altoona VA. Mm-hmm. His official title is the Chief of Stakeholder Relations. He does represent Altoona sometimes at our meeting. He has been to our meetings, but he's going to talk a little bit about the connection between our CBOC and Altoona and how vital that is and how fortunate we are to have that CBOC here in our community.
Yeah.
Most importantly, he's a veteran, so I want to thank him for his service, and I'll let him talk a little bit about what he does.
All right, Shaun, might have to, that microphone will move up if you want to move it. Oh, there you go. Or you can sit down. How about that?
That works out.
It works out both ways. It's interesting. I was reading the bio and what it is that you do in relation to the center in Altoona and then all of the satellite centers that you have contact with. It's a pretty important link, isn't it? The liaison role.
Absolutely. And we have, most people don't know this, but we have the largest region within the overall state of Pennsylvania. It's 14 counties that we cover, and we're really the kind of that central Pennsylvania. And we have 5 what we call CBOCs, community-based outpatient clinics, and one of them's here in Indiana.
Yeah.
And the whole purpose is to make sure that we take care to where veterans are. And that's absolutely a unique challenge when you're talking about 14 counties.
Mm-hmm. Absolutely. Okay, so talk about this areas, the one here in Indiana specifically, and how it reaches out, how it functions among the veteran community.
Absolutely. So pretty much at this CBOC, we've started expanding services and podiatry, telehealth programs, your primary care visits. So this is the center for all the veterans, probably within about 30 to 45-minute drive from the CBOC to come here and get their health care. Mm-hmm. And if they need other services, we've actually input telehealth programs where they can talk with the provider or the specialist over what I like to call your FaceTime, which is what everybody's accustomed to.
Sure.
It's a little more complex than FaceTime, but it's very similar. And so it links them to the entire VA system because that provider that they're talking to may be in California. And so it's really, really unique for rural veterans and veterans in Indiana County to be able to link up with that CBOC and get the care that they deserve.
I've had my father-in-law to this local center and watched how they interact. And the interesting thing with me was how very, very compassionate they were here with an older gentleman such as he in his 80s. And then there were some younger, on this particular day, there were 2 ladies that came in and a guy, all veterans as well. And to watch how they interact with them, and while their issues are different, depending upon their age and their experiences, it's that same level of care. And it was really heartening to see that the people who work there at this center have a real heart for the vets.
Well, about 1/3 of our employees are actually veterans. So when you look at our overall system, we have about 900 employees and about 300 to 330 are veterans. And so that gets me excited. I'm a veteran. I did several tours of Iraq. A lot of my staff are veterans and combat veterans. So when you go to this CBOC, chances are your nurse or the person sitting at the front desk or even your doctor is a veteran. And so when a veteran is delivering care to a veteran, it changes the absolute platform on which that care is given, which, again, is why that CBOC is so important to this community because it's care that veterans take care of veterans, but it's care and quality of care that may not be able to be received anywhere else.
I'm sure that a lot of what you do has to do with the feedback you receive from the people who use the veteran centers, too.
Absolutely. So I have a huge department underneath me in scope, and one of the things that we really look at is that patient experience. And so that's the point from when the veteran walks into any one of our CBOCs or the main facility to when they walk out, and everything that goes along with that to make sure that we expedite the care, but also make sure that we're providing a level of customer experience that they want. You know, when I sit down with my provider, I get 30 minutes with my doctor. 30 minutes to sit there and talk about what are my life goals? How do I plan on losing weight? How do I plan on getting past some of those ailments and hurdles that are placed in front of me? That's unheard of where you go. I mean, you'd be lucky to get 10 minutes. That's all part of that patient experience, and a lot of that falls within the scope of my section. I'm just really happy to do it, and I just love serving veterans, being one myself.
Now, you've been affiliated with Van Sant for how long?
About 2 years.
About 2 years.
Yeah, we just did a whole leadership change. And so I don't know, over the last 2 years, we've added about 20 services, to including services to the CBOC here. The entire leadership has changed, from the director, Sigrid Andrew, the associate director, the head of all the nurses, the chief of staff is Dr. McGee. He's been in the community for 50 years.
Yeah.
One of the best surgeons and physicians I've ever come across. Myself, I mean, it's a whole new leadership team, and over the last 24 months, it's really shown on the direction and goal and expanding that we're doing.
So that being the case, what do we need to say to veterans out there who aren't using the VA centers and aren't taking advantage of this tremendous service here in Indiana County?
So the biggest thing that I hear when I sit down with veterans is, I want to save that for someone else. I have good insurance. I don't need that. And this is not as finite as they think it is. It is absolutely a service that you need to use so that it continues to grow. So the more veterans who go to the Indiana CBOC, the better chances that we can grow and enlarge the services there. So actually, by you using the services, you're helping other veterans.
Yeah, and the interesting thing is that's exactly opposite of the way they perceive it right now.
Absolutely. Everybody comes to me and goes, I'm going to save that I don't need it. I'm going to save it for the veteran that needs it. Every veteran needs it. Every veteran deserves it.
Yeah.
And by using it, it's just going to get better and grow.
Yeah, that's an interesting perspective, Diann. I'm sure you hear that all the time.
I think sometimes the mindset is that it's a limited pool, but the pool just grows the more you use it. So that's true. And to speak about the leadership change, I've had the privilege of meeting Sigrid many times. And she is one of the most energetic people and passionate people that I've ever met, too. And I do often attend our CBOCs. They often have events there and stuff, and Shaun is always there, too. But, they support the CBOC greatly. And you can tell when you do walk in that the atmosphere is so positive and so welcoming to our veterans. Yeah. I remember the first time I got to meet her, and she was talking about, this is when she just started to become a director, and one of her... somebody had said to her, what makes you qualified? And she said, well, I have an RN behind my name. And my stepdaughter, I think she said, that I'm just really nice, and that's important. And I said, she is. She's just welcoming, and she's good at what she does.
Yeah.
You can tell in her leadership as it's trickled down, I think. Definitely.
That experience for the vet, and especially the one walking in for the first time, Shaun, can be intimidating because you don't know what you're walking into. You don't maybe even know what the services are that you're there for. Describe that experience, because you walk in, there's a kiosk there that can get you started, but it's really it's a person-to-person thing there. Describe that experience.
So especially over the last 24 months, and you'll hear me say this a lot of times when people look at a federal agency like us, they think bureaucracy and process. Well, I can tell you that we're in a unique position where we're able to put people over process, and so we're more people-focused. So when that veteran walks through the door, it can be intimidating, especially when they're looking at some of the fancy electronics. It's real simple. Let's put people in front of process. All they have to do is look at any one of the employees and ask for help. But here's the other thing that you'll notice is probably and I walk the halls of all the CBOCs and the main facility, probably within 10 seconds of someone getting that I don't know what I'm here to do or I'm confused face, I always find an employee who comes up and goes, can I help you? Is there something I can help you with? Yeah. And all our employees are empowered to make sure that the veteran gets what they deserve. And so it's just a completely different experience than what people may be accustomed to.
Yeah. Something else, and Diann, you can speak to this too, that people might not be aware is if somebody is a veteran, they might think, okay, I don't meet the qualifications. I didn't serve in a wartime setting. I didn't go overseas. I wasn't deployed here, or I didn't have this type of duty. My duties were not combat related. There are all kinds of those sorts of barriers that really are barriers that we impose upon ourselves because they don't really exist.
Right. And you don't know, you need to contact our local VA director, Al Lockhart here. Mm-hmm. Certainly find out what benefits you're eligible for. But numbers are important. And, simply going to the CBOC and asking what you're eligible for there is the first step. A lot of veterans tell me that they either like to go to Johnstown or to Altoona, for services. But we have those services now here in Indiana, and I think that's one of the things that veterans don't understand.
Yeah,
is that we do have the services have grown greatly in our CBOC.
Yeah. those travels, well, generally when you're from here and you want to travel to one of the bigger places, or you have to travel to one of the bigger places, it's because you don't realize those services are here.
And that's a barrier in itself. Mm-hmm. My father's 90 years old. I really don't want him to drive to Pittsburgh and we wouldn't let him now anyway. But, I think it's important that they know that those services are right here in their backyard and they're quality services. Yeah. They can get good health care right here.
Shaun, this particular center here in Indiana, of course, is vital for Indiana County and the surrounding region. How important is it for people to begin to use this center if they're not using it now?
So I'm glad you kind of brought up additional services, because last summer we passed something called the Mission Act. And the Mission Act allows for veterans to get care outside of the VA under two main purposes. One's distance, and the other one is access to care, a time frame. The cool thing is that when you look at access to care, we beat the community in every single standard. We can provide care quicker to the veterans on every single standard. Mm-hmm. So now we're looking at distance, right? Well, the only way you're going to qualify for the Mission Act is if you use the VA. And so if you're a veteran who wants to take benefit or to use those benefits, you have to come to the VA, get enrolled, and see a primary care every 24 months for you to use those. And now if you have an ER visit or an urgent care visit, the VA will actually step in and pay that bill when you're using the outside community. So not only are you getting high quality care and access to care, but now we're actually helping on a financial front, because medical costs are exorbitant and they keep growing. And now we're helping take care of that too.
Beautiful. He's Shaun Shenk, Diann Overman. Thanks for bringing him in.
You're welcome. Thank you.
It is the voice of Indiana County, WCCS, AM 1160, 101.1 FM.